The best new patient generator in decades is virtual reality for dental patients. Opera VR truly gives people a remarkable experience. We can completely transform the patient's awareness, transport them outside of the operatory. Go to operavr.operadds.com. Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is Dave Pryor, but he's much more sedate today.
I have no Mountain Dew.
You have no Mountain Dew.
It's tragic.
I know. I talked about it before. You took away your Mountain Dew from where we get lunch before the podcast, and you're not making me laugh while I'm...
Next podcast, I promise I will have high energy. But I'll tell you, I am pretty excited about one thing.
What's that, sir?
You made it to Oprah Magazine.
Oh, Oprah Magazine, yes. Yes, and by the way, Dave, you provide the patient perspective, which is phenomenal. But where did I learn that I was in Oprah Magazine?
From my mom.
From your mom. Your mom, Mary. It's awesome. And so I got a text saying... I can't remember what it said.
So you and I were texting back and forth, and I was like, "Oh, by the way, you're in Oprah Magazine." My mom just texted me, and you're like, "Well," and you're not leading with that.
Yeah. We have so I'm gonna pivot because I had a different podcast episode title, and we'll do that next time. But we have to talk about this because it was an unusual experience. Going back to the reason why I'm in Oprah Magazine, and it's showcasing me and Opera VR, our therapeutic virtual reality solution, which is like it's such a badge of honor for me because I've talked about him on the podcast before. One of my mentors, Darren Hardy, has a whole section in his course on being Oprah Winfrey worthy. Like, you want to do something that Oprah would want to call out. So it was like, first of all, to set the stage, this is a big deal in Bryan's world because it checks the box that Darren Hardy said about Oprah Winfrey, right?
Yeah.
And prior to that, I'd say 2 months before, I got a message at the office. Somebody called. So for those that haven't listened to the podcast before and don't know kind of our world that we live in, we have sort of a unique technology company where we have one floor of my 3-story building that's the technology companies, and then 2 floors that are the dental practice, right? Yeah. And it's really cool because we can create the coolest and most innovative stuff in dentistry, bring it upstairs, and they tell us how it's broken, and then we fix it, and then we release it to the rest of the world. But in our little world, there's 2 different sections. There's the dental office upstairs and the technology companies down below, where said Opera VR was born and being used to transform people's experiences up above. So I get a message downstairs in the operatory, so to speak, in the operability headquarters that says, somebody from Oprah Winfrey's organization called. And I'm like, fantastic. What's the number? Oh, they forgot to take a message. They forgot to take a message in the dental practice when Oprah's calls, right? And so there was a little bit of not nice things that Bryan was thinking and saying at the moment. but I'm like, well, that's gone forever. And so then when you sent me the thing that we actually like made it into the magazine without them even being able to contact me, that was a happy day.
Yeah. Well, did you have any sort of corrective conversations with the person that didn't leave?
They're smart upstairs. They know not to tell me who made that mistake. And yes, no, I was not. I don't know who didn't take the message. I just know that there was no message taken. They called the dental practice. Oh, they were probably like, oh no, that's downstairs, not up here. Click. Oh yeah, no, but it is I mean, it really highlights the fact that people care about their experience in dentistry.
Oh, yeah.
I mean, to the point where somebody saw at the Oprah Winfrey organization probably saw some local news that I was on or some other news. We've been in Women's Health and Men's Health magazine. They saw something else I was in and were like, we've got to put this in Oprah freaking Winfrey's magazine. Like, she's a titan of entrepreneurship. And is it because Opera VR is so absolutely fantastic? I'd like to think so. It is really, really good. But it really highlights the fact that, I mean, why you're here on this podcast. It's all about the patient perspective, which is so fundamentally different than the way we in dentistry typically view it.
Yeah.
I don't know if you want to speak to that from the patient perspective at all.
Well, when I just had my crown done recently, I used Opera VR in a procedure for the first time. And as we've talked about on this podcast a million times, I don't have dental anxiety because my best friend is my dentist. And so it's just not part of my world, getting anxious in the chair. However, what I did notice using this Opera VR for the first time in a dental procedure was that it just took me out of focusing on anything. And so one of the things that's always been kind of a hassle for me when getting any sort of dental work done is that, my spit would build up and I'd be like, all right, I'm doing the countdown in my head for when they're going to do suction and get the spit out of my mouth. And that sort of thing didn't enter into my mind. And so, just the whole thing of how often, I talk to people that really struggle in dentistry, that really struggle with getting the fact that this is going to impact the patient perspective. Take yourself out of your own perspective and take a look at this from the patient side of things, and it's really a world of difference. And it even I was guilty of it, and I'm not in dentistry. I'm in I'm business development, and so when I started, I've been selling this thing for 2 years now, and I get it. I get that it's cool, and I get that it takes you out of your headspace, and is certainly going to be more impactful on somebody that's anxious. But as somebody that's not anxious, I was like, wow, that was really an entirely different experience. Mm-hmm. And so it's I get how people really get revved up before they go in, and every magazine article that we're in every single time, and every news interview that I just went through and did a whole new slide deck, and I was looking at all these different interviews and all these different magazine articles, and time after time after time after time, the interviewer says, oh, none of us like going to the dentist. I hate the dentist. And it's a common theme. And so if we haven't beaten it into everybody's head on this podcast that the patient's perspective is entirely different than the medical professionals that are listening, then we've failed them.
No, you're right. But it's hard. It's hard as the dentist, because we've got our own stuff to deal with.
Yeah.
We've got to deal with the patients, right?
Right.
We've got to deal with anxiety and people flopping around. And it's hard to see that if we actually look at it from their perspective, it's actually helping us do our job.
Yeah.
Appreciate your perspective on someone without anxiety going through, because I had the same experience when I used VR when I got my teeth cleaned. I was like, oh my God, this is actually really nice.
Yeah.
Because in my brain, as is in your brain now, we're always thinking about the anxious people.
Yeah.
But truly, the beach is better than being in the dental chair.
Yeah.
Right?
Yeah.
It's better to be entertained than sitting there not anxious.
Right.
And guess what? It's better for the hygienist, for the dentist too.
Right.
Because exactly. And
I talk to doctors about this all the time, that you all have TVs in your operatories, and I get it, but nobody can see it because you're in the way. So this thing it really is a phenomenally different experience.
Yeah, and we have obviously lots of podcasts that we've talked about VR.
Yep.
So I'm pivoting a little bit as we wrap up this episode. I think VR belongs in every practice, but looking at it from the perspective, as Darren Hardy would say, on what are you doing in your practice that would make Oprah go, that's damn cool.
Yeah.
Right?
Yep.
It doesn't matter if you have some people have like their practice, the environment looks like a like a rock band studio or underwater themed or whatever you're doing. Like, what are you doing to differentiate yourself to actually drive people's experiences where they want to tell their friends?
Yeah.
You know, because if Oprah's doing it, that's great. But if your patients are telling each other, that's really what you should strive for.
Yeah.
And so when making decisions in your practice, should I do this? Should I do that? Really think about it from the perspective of what would Oprah Winfrey want you to do, right? And that's really why when I got the text that your mom saw it, I was like, woo, mission accomplished. So thank you, and thank you to your mom.
You're welcome, and I'll pass that along to my mom.
I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.